Hello and welcome everyone to our 33rd Cape Community of Practice event. My name is Amanda and I'll be introducing today's session. Today's topic is alcohol industry activities, how to identify commercial framing and take action for public health. Please note that the views and opinions expressed as part of this presentation are those of the presenters and do not necessarily represent those of our funders or other organizations acknowledged. Catherine Paradis, PhD, is a public health sociologist recognized for her work in alcohol policy and harm reduction. Currently a technical officer at WHO Europe, she leads the implementation of the EVID Action Project, translating evidence into effective alcohol policies. Formerly the Director of Health Promotion at the Canadian Centre on Substance Use and Addiction, she co-led the update of Canada's low-risk drinking guidelines, aka the Canada's Guidance on Alcohol and Health. With 2 decades of experience across research, policy, and advocacy, Catherine is known for her leadership, strategic thinking, and ability to impact partnerships that drive change in public health across diverse communities and countries. So I'm just going to quickly switch over to Catherine's presentation. Just give us a moment here.
Begin by thanking the CAPE team for organizing this important webinar and for inviting me to join you today. It really is a privilege to speak with you, with this community of practice, especially on this topic that is quite critical, right? The persistent obstacle we face when alcohol-related issues are approached through narratives and framings that have been developed and promoted by profit-seeking industries. As you know, alcohol remains one of the leading preventable causes of death and disease around the world. In the WHO European region alone, alcohol will contribute to nearly 800,000 deaths this year, mostly from chronic disease like cancer, cardiovascular disease, and liver cirrhosis. And yet, we know that this is not inevitable. We have clear evidence that well-implemented alcohol policies can save lives, reduce inequalities, and help build healthier and more resilient societies. Next slide, Amanda, please. So in today's session, I have to take a little detour. So I'll focus on 2 key areas. So first, I really want to share with you real-world examples that illustrate the extraordinary potential of WHO's best buys in terms of alcohol policies. In particular, I will bring your attention to lessons drawn from experience in the Baltic states and especially in Lithuania. And then we'll turn to the more difficult discussion, and that is how commercial actors, and particularly the alcohol industry, works to delay, weaken, or block these very same policies, and what we can do to counter their influence. So next slide, please. So let's begin with a hopeful story. And we know how to reduce the harms caused by alcohol. The WHO's best buy and most recently the quick buys are not just theoretical tools. These are evidence-based, highly cost-effective interventions that have already proven their ability to reduce harm, save lives, and support public health systems in countries around the world. In the case of quick buys, we're talking about measures that can deliver measurable public health impact within just 5 years. So it is within the reach of a political mandate. In Europe, we've seen this in action. The Baltic states, Estonia, Latvia, and most notably Lithuania, have emerged as leaders in the implementation of these strategies, and their experience offers lessons we can all learn from. Next slide, please. So I understand that Lithuania may not be a country that often makes headlines in Canada, and I have to admit that since I joined WHO, I have a European map on my desk because there are 53 countries, and I was not familiar with all of them until I joined. But yeah, so Lithuania, what is it? It's a small country for sure in Northern Europe with a population of about 2.8 million. But since regaining independence from the Soviet Union in the 90s, Lithuania has really pursued rapid economic and social transformation. It joined the EU and NATO in 2004. It entered the Schengen area in 2007 and adopted the euro in 2015. Today, Lithuania is really recognized for its innovation, notably in digital health, and significantly for our discussion, this progress they've made has included major investment in public health policy, especially alcohol control. Between 2016 and 2018, Lithuania implemented a comprehensive set of alcohol policies. These included substantial increase in excise taxes, a reduction in alcohol trading hours, and one of the strictest bans on alcohol marketing in the world. The outcomes were rapid and impressive. Next slide, please. So a picture is really worth 1,000 words, and this graph over here tells a powerful story. Every time Lithuania relaxed alcohol policies, as indicated by the red lines, they saw a rise in alcohol consumption, followed by a decline in life expectancy. And each time the government tightened alcohol policies, as shown by the vertical green lines, alcohol consumption, which is the blue line, dropped and life expectancy increased. And you can see how incredible coordinated that is. And so this simple visuals tells us what the research confirms: strong policies save lives. And it doesn't take decades to work. The impact can be seen within months. I really want to before we go into the playbook and commercial interest, and if you go to the next slide, Amanda, I want to share with you two concrete examples that are not even, well, this one has just been published and the next one is not published yet. The restriction of availability. It's really impressive. On January 1st, 2018, Lithuania reduced the number of hours during which alcohol could be sold. On Sundays, the hours were cut from 14 hours to just 5 per day. And on the other days, they were reduced from 14 to 10. The goal was to reduce binge drinking and its associated harms. And the results were striking. Before this policy was introduced, Sundays had the highest mortality from external causes. People were coming into the emergency room with injuries and being the victims of accidents, and this was the day with the highest mortality. Mondays had the highest mortality from cardiovascular diseases. The policy was introduced, and those mortality spikes completely disappeared. In other words, a seemingly simple change in trading hours altered the weekly pattern of alcohol attributable death among men in Lithuania. And beyond mortality, I mean, as we're all looking for money for our health system, you can just imagine the ripple effects, like how the job of people working in the emergency rooms was it was less difficult on Sundays, and how in cardiovascular unit, the job was easier on Mondays. So anyway, a big impact. If you go to next slide, Amanda, please. Marketing restrictions. At the same time, Lithuania also implemented a near total ban on alcohol advertising, covering TV, radio, online platforms, yes, it is possible, and promotional contests. And a study evaluating this measure found a 54% reduction in the frequency of intoxication among adolescents following the ban. There was also a 56% reduction in the prevalence of intoxication among adolescents. So really put simply, without the marketing ban, what this study has shown is that adolescent drinking would be significantly higher today than it is. So Lithuania's success underscored the power of evidence-based policies to reshape public health outcomes, especially for the next generation. But these achievements did not come easily. Throughout the process, the Lithuanian government faced enormous pressures from the alcohol industry to weaken or abandon these policies, but they stood firm. And when I say that there were pressures, the minister who was leading it all received death threat. He was followed everywhere. I mean, it really was no picnic. But he had decided to prioritize health over profit. He trusted the evidence, and the result was a healthier population and today a stronger public health system. So this brings us to the other side of the stories, the ways in which commercial interests attempt to obstruct exactly this kind of progress. And if you go to next slide, please, Amanda. So industry interference in health policy is not unique to alcohol. It's part of a broader pattern that WHO calls the commercial determinants of health. In June 2024, so last June, WHO launched a major report on this issue, showing how industries like alcohol, tobacco, and ultra-processed food use their economic power and political influence to shape health policies in ways that prioritize profits over people. These industries all use a familiar playbook: the lobby against regulation, fund biased research, they build political alliance, engage in marketing campaigns that frame themselves as responsible actors. And here I can't help, so probably that some of you on the call may remember that during the rollout of the guidance on alcohol in health in January 2023, we received a lot of opposition from a group called ISFAR, a group that presented itself as a forum of scientists critically looking at alcohol research, when in fact it's a group funded by the industry that promotes outdated and misleading narratives about moderate drinking. So we've really experienced firsthand here in Canada. And I mean, these people were just going around every ministries across the country, across every provinces. So that brings me, next slide, please, to the alcohol policy playbook. So as part of its broader effort to address the commercial determinants, WHO developed the alcohol policy playbook to help policymakers and advocates confront industry interference in alcohol policy. This resource provides evidence-based counter arguments to common industry narratives, insights from successful policy implementation, and strategies to anticipate and neutralize opposition. The playbook is designed to serve as a tool for governments, for policymakers, but I mean for all of you to maintain independence, not only in policymaking, but in the way we approach alcohol, to really ensure that public health remains the priority. So the playbook, some of you may know, is divided in two main sections. The first one focuses on general questions that people may have about alcohol in general, its relationship to health and the harms and costs associated with its use. And the second part focuses on questions that people may have about alcohol policies in general, like the quick buys, for example. So what we found going through the whole process of designing this playbook is that regardless of the questions people have about alcohol, one of the most pervasive strategies used by the alcohol industry is really the dissemination of misinformation. So for instance, the industry consistently downplays the health risk of alcohol, including its role as a group 1 carcinogen. The playbook highlights how industry representatives often promote alternative causation narratives to really obscure the link between alcohol use and cancer risk. They will suggest that cancer is caused, it's too complicated. Cancer is a multifaceted disease, and they really try to divert attention from alcohol's direct role. Another very widely tactic, of course, is lobbying. And the playbook, through all of its different sections, underscores the industry's efforts to delay the implementation, for example, of minimum unit pricing in Scotland. So using trade agreements and legal challenges, alcohol producers really managed to stall minimum unit pricing for 6 years. But however, when it was finally introduced in 2018, it resulted in a significant 13% reduction in alcohol-related death and a decline in hospitalization, a clear testament to the effectiveness of evidence-based policy despite prolonged industry resistance. So you see, they will always try to build some sort of rationale to make people believe that it won't work for multiple reasons. But when we finally have a chance to actually test it, surprise, surprise, policies do work. Another thing that the industry will very much do is rely on corporate social responsibility. Those types of initiatives represent another tool used by the industry to really deflect so the playbook reveals how alcohol companies will, for example, sponsor community programs and youth education campaigns to portray themselves as responsible corporate citizens. However, these initiatives are often a smokescreen to avoid stricter regulations. Um, and, very often I will come across policymakers who will say, well, in my community, they really want to help with this big party that we will have in the community, and they want to be there, and they're going to be not selling alcohol, but supporting us and serving water and non-alcohol drinks and what have you. And very often, what policymakers fail to see is that they might do so that time. But when there will come a real negotiation about something, of course they will bring this back and say, do you remember when you needed money to organize your community fest and that we helped you to do so, So you need to be very careful about those types of strategies that they use. Let's go to the next slide, Amanda, and let me just see where we are. Yeah, okay, so availability policies. Yeah, I wanted to come back to that because I just talked about, broad strategies that the industry use, but just before I showed you the impressive results of availability policies in Lithuania. And while the public health benefits are clear, implementing these policies is rarely straightforward. And what we found through designing the playbook is that when it comes to those types of policies specifically, they will consistently be met with resistance that will usually take four different forms. One of them, when a government will try to implement, say, we should reduce the number of hours or the outlet density, they will blame the culture and say the industry narratives will argue that alcohol-related harm is due to cultural or social factors, not when or where alcohol is sold. This reframes the problem as one of personal failure and not necessarily policy failure. Another thing that they will do is rather than support regulation, they will propose a partnership with retailers. But again, we have evaluation of these programs. In the playbook, there's the example of the UK's community alcohol partnerships, which shows that whenever there's partnership between government and the industry to tackle harms, it fails. It has very little impact. So it cannot be seen as an alternative to policies such as the availability one. Another thing that they will do, if you would come to policymakers with the idea of availability policies, is they will claim not only that they won't work, but that they could backfire. And they've become very clever at explaining that, that it will all backfire, that, for example, this may lead people to go in Canada. I guess it would be on some reserves where traditionally it was possible to have alcohol on the illegal market or so on and what have you. But the global evidence really tells a different stories. that in fact availability policies are always associated with reduced harm. And of course, they will frame this as anti-businesses, and we've all been witness to that whenever we talk about policies, the industry will warn about job losses, economic harms, and limits on consumer choice. But these tactics altogether, they really don't engage with the evidence that we have on the public health impact of these policies. All these tactics, all these narratives, all these ways of presenting the policies are really there just designed to protect the commercial interests. That's their business. That's what they do, and that's what they aim to do. So what can be done? Next slide, please. So it's really important for governments, but for anyone, within communities, within municipalities that interact with governments, it's important to address these challenges head on. And this requires, first of all, transparency and accountability. All policy decisions, any decision at the that is made with regards to alcohol policy must be free from conflict of interest, and any industry influence must be publicly disclosed. That is really clear, and we are pretty good at that in Canada. We need to get even better. We need to strengthen advocacy. What I mean by that is that together, all of us, the public health community, all of us who would like to see a reduction in the harms caused by alcohol, whether it be health harms or safety, all of us, we must be informed, we must be united, and we must be persistent. We must be better at speaking with one voice. And there's been a shift in that recently, and it's very interesting because it seems to start to be working. And yesterday, Diageo actually posted a job offer for a global alcohol policy manager. And in the post, it was stated the following: our industry is facing unprecedented challenges from the WHO and its NGO network, globally and regionally, who are increasing pressure on member states to adopt stricter regulations for alcohol to reduce overall consumption and not just harmful drinking. These measures could include increase in alcohol taxes, bans on alcohol advertising, and marketing availability restrictions and health warning labels. So you see, it was quite surprising for us to see that yesterday and see, you know what? When we start speaking as one voice, as being united, as being strong together, they know this and they start to be afraid. And this also leads to the third point, which is international cooperation. The industry operates globally, so countries must work together to prevent regulatory loopholes and ensure stronger protections from all. So Amanda, this is going to be my last slide. So where does this leave us? And here's my main message to you. Whenever you are asked a question about alcohol or about alcohol policies, or presented with an answer, always ask yourself this: who is speaking? Who is behind this answer, this way of portraying alcohol, its impact, and alcohol policies? Is it someone whose job is to generate profit for an industry? Or is it someone whose role is to promote and protect public health and public safety? That should become your reflex. Don't be fooled, and teach others not to be fooled. And even if the voice seems to be an authority on the matter, or someone who's working in a ministry that is supposed to be dedicated to health, still ask the question. When they provide you with a fact, where did you get this? Could I please have the article from which you're deriving this narrative, and so on? Always ask. We really need to do that. The alcohol industry often claims that they must be consulted because it is their product that we're talking about, right? So they say that they know alcohol best and therefore should be part of every conversation about this, that they should shape the conversation. But this is exactly where the problem lies. Alcohol is not the object of our work. Public health is. And what does the alcohol industry know about public health? Nothing. Sweet nothing. So we do not share the same goals. We do not operate in the same space. They live in the universe of alcohol sales. We live in the universe of public health. So if we, and some of you have heard me say that for years, but if we truly shared the same objective, as they sometimes claim, the relationship would be reciprocal. We'd be invited to their boardrooms. We'd be invited to design their marketing strategies or brew their products, but we're not because we have no expertise in selling alcohol, just like they have no expertise in safeguarding health. So remember this, sharpen your reflex. Teach your teams, your ministries, the people you work with to ask the following question. Is this information coming from a public health perspective or a profit-seeking one? And distinguishing between the two is the first and most essential step to reduce alcohol. And if we stay clear-eyed about who we're listening to, we have a far better chance of protecting lives. So this is what the playbook is all about. And yeah, I would invite you to read into it and reach out to us. And if you have additional questions that you feel the industry is sort of controlling and that you would like us to address, I'd be happy to answer your call. And Amanda, I think I've extended my time, so I will stop here.